Hello, welcome to the Parkinson's Foundation Wellness Wednesday program, Taking Charge Strategies for Meaningful Healthcare Visits. Thank you for being here today. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. The Parkinson's Foundation gratefully acknowledges MERS Therapeutics for their support of the Optimizing Care initiative. Today's program is part of our PD Health at Home virtual program series. Each week, we offer sessions tailored to support people with Parkinson's and their care partners, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, care partner programs, and expert briefings. We also have our Spanish language series, EP Salud in Casa. Please be sure to visit our website to see what's coming up and explore our videos on YouTube. Learn more about upcoming virtual programs and register at parkinson.org/pdhealth. We're pleased to offer today's program as part of the Parkinson's Foundation Optimizing Care initiative, Taking Charge Strategies for Meaningful Healthcare Visits. Navigating Parkinson's requires an active and informed approach to healthcare. This program will encourage individuals living with Parkinson's disease to take charge of their care by providing strategies for effective communication and self-advocacy before, during, and after a healthcare visit. We'll learn how to make the most of each appointment by prioritizing your needs and preparing questions and concerns in advance. You'll also gain access to a valuable tool and resources to help support you every step of the journey. Presentations for this program were recorded in advance, but we'll have time for a live Q&A session at the end with one of our expert presenters. In the meantime, please submit your questions at any time using the Q&A button on your screen. We have 3 expert presenters for today's program. First, we'll hear from Dr. Mohammed Nashatizadeh, a board-certified neurologist and director of inpatient movement disorders at the University of Kansas School of Medicine. Dr. Nashatizadeh, known to many as Dr. Mohammed, brings a deep expertise in treating complex movement disorders in hospitalized patients. He also trains neurology residents and fellows, earning repeated recognition for excellence in medical education. He completed his medical degree and neurology residency at the University of Kansas, followed by fellowship training at the Baylor College of Medicine. His research focuses on atypical Parkinsonism and the overlap of movement, cognition, and sensory disorders. Afterwards, we'll hear from Dr. Kathleen Blake, a retired cardiologist, health policy leader, and passionate Parkinson's advocate. She served as vice president for healthcare quality at the American Medical Association, where she focused on health equity, value-based care, AI, and patient safety. She also chaired the federal Health IT Policy Committee and helped lead the National Evaluation System for Health Technology. Since her Parkinson's diagnosis in 2017, Dr. Blake has been a powerful voice for the community and now serves on our People with Parkinson's Advisory Council. She trained at Stanford and Johns Hopkins and practiced cardiology in New Mexico for over 20 years and continues to teach part-time at Johns Hopkins. Finally, we will hear from Taylor Rush, a clinical health psychologist at the Cleveland Clinic's Center for Neurological Restoration. She will also join us for the live Q&A session at the very end. Dr. Rush serves as Director of Behavioral Health Services, leading a team that supports patients with Parkinson's and other movement disorders. She helps individuals adjust to diagnosis, manage depression and anxiety, improve communication, prepare for surgery like DBS, and incorporate mindfulness to support emotional and physical well-being. Thank you to our presenters, and thank you again to all of you for joining us. We'll start the presentation shortly.
One of the things that I'm really excited to talk about today, before some of our other panelists join, is talking about how you can get more out of your interactions with healthcare professionals. Many people who have Parkinson's disease are not suffering alone. They often have family members and caregivers to help and support them. But many times, people over the years, having been a movement disorder specialist now for 17 years, they will confide in me that they often feel like they are not getting as much out of medical visits. And I'm here to talk more about why an active approach to care matters. I remember when I started medical school 26 years ago. I like to say that I went to medical school back at the turn of the century. There was a lot of discussion about access to care. And what usually that meant was whether or not people had medical insurance to be able to afford going to the doctor. But over time, it's not so much that that's the only barrier. There are many people who have financial ability to afford going to healthcare professionals. They have medical insurance. They may have medication coverage. But the shortage of neurologists and movement disorder specialists continues to be a growing problem throughout the United States. Some of you may already be familiar that the Parkinson's disease numbers based on research from Parkinson's Foundation. There was a study back in 2023 that looked at where are people with Parkinson's disease receiving their care. And it turns out that only 9% of people with Parkinson's disease are actively seeing a movement disorder specialist. This is usually a neurologist who's had additional training in the area of Parkinson's disease and other movement disorders. As you can see from the orange slice on the pie graph, the number of people with Parkinson's disease who actually have no healthcare professional is more at 11% than the number of people who have a movement disorder specialist. And half of people are seeing a general neurologist. The rest are seeing their primary care provider, whether that's a physician, a nurse practitioner, a physician assistant, who may be supportive and helpful, but may not have a lot of additional training in Parkinson's disease. At the same time that study was being conducted, it was determined that nationwide, for 340 million people, and probably 180 million of them being adults, there are only 660 movement disorder specialists in the entire United States. And even though it seems like, well, that's several hundred, that shouldn't be a problem, recognize that most people who are movement disorder specialists, a full load of patients may be somewhere between 2,500 patients to maybe 4,000 or 5,000 patients. And so each patient also has family members or other caregivers. And so the wider net of the number of people who are affected by Parkinson's disease is very high. Many times when neurologists or even other specialists are trying to establish a care practice, one of the things that often comes up is that we are taught to be thinking about our overall support system as physicians and as nurse practitioners and as physician assistants. And so being able to be in a place where there may be enough accessibility for patients, to have other colleagues so that if you need somebody to cover for you, these are all important considerations. And so it's not surprising to me that when they looked into this, out of the 660 movement disorder specialists in the United States, it turns out only 6 are in rural areas. And so this often means that many people with Parkinson's disease are traveling anywhere from 30 to 45 minutes to upwards of even 5 to 6 hours just to be able to go and see someone who has this specific training in managing Parkinson's. So no matter how long the travel times are, or no matter how many weeks or months it takes to get in, whether as a new patient or as an established patient with follow-up, when you show up to your healthcare provider, there's a lot of important material that's Parkinson's disease related to cover in a very short amount of time. Many people will say that they only have a 15-minute appointment, and that may be once or twice per year. There are certainly some people who may have longer follow-up appointments, like 20 or 30 minutes. And some people will say maybe they can even see their specialist up to 3 or 4 times per year, especially if they have a lot of problems that are active and they're not under good control. But these numbers are sort of the average. And so if a person only had minutes with their healthcare provider per year to talk about Parkinson's disease, I hope that some of the specific strategies that some of the other panelists will be covering today, I hope that you'll be able to pay attention because I think they give some very useful advice on how to make the most of the time that we have together. The example that I've sometimes given, and I would hope that most of us who are movement disorder specialists, neurologists, people in healthcare who care, we certainly don't think of ourselves as like self-important or that our time is like super valuable. You know, we're helpers. We want to be able to help people. But ultimately, if I knew that I had a very important discussion that I needed to have with the governor of my state, and this would be planned 2 or 3 months ahead of time, it would be usual that I would want to show up prepared. I would have some notes. I may have spent an hour of time or maybe longer to organize my thoughts so that when I could show up and speak to this person who's going to have hopefully a tremendous output or benefit for whatever it is I'm asking, that I would be prepared and I would use their time carefully so that I would get the message across clearly. Sometimes people with Parkinson's disease, and this is usual, it's hard to quickly identify what the priorities are. Parkinson's disease isn't just about movement. There are often non-motor problems. There are often mood, sleep, cognitive problems that are ongoing. And so part of being able to focus the time is to prioritize. I might have 4, 5, 6 things that are going on that I really want to talk about, but what are the two that are the most important? What's the third one in case there's more time? And having that organization allows you to prioritize so that the next time you meet, or even between visits, you may be able to try to continue to work on some of those things that were further down the list. Appointment times run on schedule. As you see, even with this webinar, things will run very carefully and clearly, and there's been a whole team of people that have been organizing this. And so time is important. And sometimes appointments can end without covering the material or the topics, the priorities that are the most important to you. So if you tend to speak very openly, but not in an organized manner, the time can run out and then you miss out on that opportunity. And many patients have said that they have struggled with this. That's why I'm really glad that Parkinson's Foundation is addressing this issue today. You want to make sure that your questions and concerns are answered. There's some sort of process that's ongoing. You want to be clear about what the next steps will be. And you want to be able to have connections to other resources, whether they're local or online, to be able to continue to work on the problems even outside the visit. A lot of people who have Parkinson's disease, they are not brand new at being an adult. They've often lived as adults for many years. And so that also means that a lot of us are sort of set in our ways of doing things. We know what our strengths are. We know the things that we struggle with the most. And so sometimes when you're trying to get the most out of a situation, there can be a little bit of anxiety or a little bit of discomfort about trying to do things in a different way. Sometimes we latch onto the things that we're used to and the methods that we're used to. But having a shift in thinking can often be helpful. And it doesn't have to be that you completely overhaul how you approach your visits with a healthcare professional. There are actually some simple steps that a person can take to have more meaningful appointments. Remember, you're the one who's going through the process. So you're the expert on what your experience is. Your healthcare team relies on you to share about what those concerns may be and what the priorities will be. And this is true for patients and family members and caregivers. Be an active partner with your healthcare team. Work with them. Present the concerns. If the last appointment didn't go well, maybe it's time to mention something and say, I really want to make sure that I talk about the things that are very important to me because I really value this time that I have with you. It is usual that that might feel uncomfortable at first. Sometimes people struggle to have their voice uh, if they don't feel that they're heard. But it will get easier with practice. And sometimes even talking in front of a mirror or talking with another family member or caregiver and saying, these are the things I want to bring up. I would like to have a practice round to go through this. Together, you and your healthcare team can help make the most of your Parkinson's care. One strategy that I want to highlight is to think of this as like a cycle, just like going through any other cycle, whether you are washing uh, dishes, whether you are doing laundry, there's sort of a process to remember. And then, my wife will attest to this. Both of us, I feel like we just have never ending laundry at our house. And so the minute the laundry's done, we sort of get back into the process again. But the appointments that you have with a Parkinson's disease healthcare professional also fit a cycle. So there's the time where you are before your appointment, there's the time when you're actively during your appointment, and then there's the time afterward, which is between those two appointments. And so when you start off beforehand and you have a plan and you say, I want to make a list of the top 3 questions or concerns. If they're delivered efficiently, it is possible that they may be even able to help you with more than those. But having at least that organized ahead of time means that you're not running out of time. During the appointment, it's very important to go in with the mindset that you need to speak up about what matters the most to you. And so this way, if you start to feel nervous or you feel like I'm just going to go back to my old habits and even the best laid plans, and then you're in the appointment time and then you're not sticking to the the thoughts that you had, this can be a struggle for people. So that's why you have to go in during the appointment and say, I'm going to be ready to do it this way to try to engage my healthcare professional. And then taking action to live well. It's not just many people are sort of trying to get from appointment to appointment, but the time between your appointments, that's your life. And so being able to take those actions and work with those other local or community or online resources or the suggestions that your healthcare professionals offered to you, that's the time to take action. If that action isn't working, there may need to be some feedback even between visits. But otherwise, then the cycle can repeat. So I want to thank you again for attending this webinar today. I think that you will find that the panelists who are here have a lot of excellent anecdotes. They have experience going through this themselves or helping others with Parkinson's disease. And so,
Krista, thank you so much for that kind introduction and really for the opportunity as a person with Parkinson's to be able to share my perspective on what we've just heard and also really sitting on both sides of the table. My years of clinical practice have paid off in spades for my experience as someone with Parkinson's. So what is self-advocacy? And it's not just politics. Advocacy means that you are actively participating in your care and that it is important, not just to you, but your care partners, the people who care about you. And self-advocacy means that you understand, and it may be that you come to understand over time what it is that you need. And especially with Parkinson's, because it is a chronic condition, a progressive neurologic disease. What you need at one point in time may be different than what you need in 5 years. So I always think of focus on the present, think about the future, but take care of yourself now. Self-advocacy also means you know how to speak up for yourself. And for me, that's no problem. For some people, it is a learned skill. And our goal with this webinar is for you to learn how to do just that. And also that you have the information you need to make good choices. Some of it you will find yourself, but we strongly urge you to use sites like the Parkinson's Foundation website, parkinson.org, or to use our helpline, and that is 1-800, I'll get it. We'll have it for you up on the screen shortly. And self-advocacy matters because you're the only consistent member of your healthcare team. You are present throughout, not just during the clinical visits, but you are present between the visits that you have with the people helping take care of you. You are the expert on you, and you may not use the fancy medical terms that you might sometimes hear batted around, but you know how to describe what you are feeling. And for those looking, the helpline number has just been put up on the chat. And because self-advocacy matters so much, how will you know it? It can have a real impact on the care that you receive. I'm going to go back to this just terrific flow diagram that you've seen just a little while ago and really go a little bit deeper on some of the different steps, but particularly the making of a list of your top 3 questions or concerns and learning and then being able to speak up about what matters to you most. And it is very much, as you just heard, that you would not think about going into a visit with a lawmaker or perhaps even with an attorney or some other individual who can have a significant impact on your outcomes without some pre-planning. And don't be embarrassed about the need to pre-plan. We all pre-plan. Probably the people taking care of you have pre-planned the visit by reviewing your chart, your prior visits, any test results. It's fine to come in with a list of notes. Seeing it in writing really forces you to prioritize your top 3 questions, and they may not come up on the first sort of draft of what those will be. And my experience tells me that people oftentimes don't get the order quite right. They ask the easy questions first. What about this? Can I get a prescription for an exercise program? But really what they want to talk about is, I'm having trouble sleeping and I've actually been kicking my partner in bed at night. What can I do? So things that we may be more reluctant to discuss. And I've also found that people are reluctant to discuss issues that might result in a change in their level of independence. So don't cheat yourself by just asking the easy questions. Ask the challenging ones first. In terms of being able to actually speak up about them, during the visit itself, you have the list. You can take notes. And you can also, there's nothing wrong with keeping your eye on the clock because there is a clock. It's a mental clock. It might be on the wall as well. It might be in people's watches, but keep your eye on the clock because then you can say, I want to be sure we get to the 3rd topic on the list. I don't want to miss the chance to get your input on that. And then the benefits of pre-visit preparation. I would add to this list, which is here, figuring out, are there ways that I can front load information so that we get right to my top concerns? This particularly is important by reviewing your list of medications because different clinicians may be seeing you, not just for Parkinson's, but also for any other conditions you have. So looking at that list, I've gotten to the point where I go over my list with a fine-tooth comb. And it's only recently that I walk in and the list is correct from the get-go. Preparation shows you and the people taking care of you that you really do want to be an active member of the team and that you want to be sure that your healthcare needs and concerns are guiding the appointment and that you get the kinds of referrals and resources you need. And quite frankly, then the people taking care of you feel much better about the visit that they've just had because they don't want you to leave saying it was a bad visit. Now, in terms of bringing a companion to appointments, I think that this is something where people vary over time. It may take some getting used to, the idea that someone is going to come with me. But some of the things that can help you are to have a conversation with the companion who will be joining you, and say what your expectations, what you would like their role to be during the visit. So they may interrupt and say, you know, Kathy, you forgot to mention such and such, or you're not getting to topics number 2 and 3. Or they may say, you know, I think she might be underestimating how much of a problem her sleep is, whatever it might be. So they learn how to be that gentle nudge, the record keeper. They're also able to, when you go home, and typically you'll arrive together, you may leave together, you'll be able to have a conversation about what did we both hear, and they'll be able to support you between your visits with your clinician. And as a reminder, it does not have to be the person, let's say, who is your spouse or your life partner. It can be the person who you feel will best serve in this particular role. And what are the benefits of open communication? I think it should be clear from now or by now that without open communication, your important concerns may just not get addressed. So this visit, we're trained to be pleasant people, but it's not about being pleasant and it's not about chit chat. It is about you and your Parkinson's concerns. With open communication, it really does foster trust. Your healthcare team feels like they know you and you feel like they know you also. And they're able to recommend treatment options and resources that might better fit your needs and concerns.
And thank you everyone for being here today. I'm truly honored to be part of this incredibly important conversation because as someone who works embedded in a neurological center for movement disorders, I talk to patients a lot about their medical appointments, ones that they have that are coming up, ones that they've just recently had, and how did they go? And I definitely see some common threads in terms of the types of things that people are concerned about. So things that have been touched on already in terms of, you know, the limited amount of time that you have to review your concerns with your provider. There's anticipatory anxiety about, am I going to remember everything that I wanted to for this visit? And will my provider understand where I'm coming from? Will they potentially judge me for some of the concerns that I have? Because sometimes people may have symptoms or issues that are new and maybe scary or uncharacteristic. And so because we can see with Parkinson's, you know, impulse related issues or sometimes issues with hallucinations or other things that are incredibly important to bring up to your provider, but people don't always like to talk about openly. So we discuss a lot about how we can do that in a meaningful and effective and efficient way. So I want to talk to you guys a bit today about some of those skills and strategies that I often share with patients and ways that you can incorporate them at your next visit. So you've heard this message already, but I'm going to really, you know, take it home that, you know, you are the world's leading expert on you. There is no one else who knows you better than you do. And I think it's really important when you come into these conversations with your medical providers that you remember that at your core. Because I think a lot of times people may have this core belief that, you know, well, the doctor knows best, you know, they will let me know if something's important or not. No, you're the one who goes home each day and has to live your life in your body with your symptoms. Therefore, what you have to say is truly the most valuable part of this visit in order to get what you need out of it. And a few kind of pearls of wisdom per se that I'll often share with patients is one, sometimes healthcare professionals forget what they know. So we live in you know, these medical environments where we use jargony phrases that most people have no idea what it means and a lot of abbreviations for things. And sometimes we forget that other people don't know these things. And so to ask questions that may feel, you know, we always say there is no such thing as a stupid question, right? Because you don't necessarily know everything coming in as the same as your provider. So recognizing that sometimes you have to call that out and be able to ask for additional explanation on things. And your perspective and questions are not going to cause offense. I think sometimes people think that they may interject too much, or they may talk too much, or they may have strong opinions about things and they don't want to be seen as difficult. But truly, it is important to share your perspective and your questions and things that you're confused about. And it doesn't make you look incompetent, and it doesn't mean that you're being difficult. It just means that you require further clarification, as most people do during these visits. And of course, sharing your personal goals so that your provider understands what matters most to you. So I have patients where their ability to play golf is incredibly important to them. Their ability to run after their grandkids and be able to care for them. Their ability to cook a home cooked meal for their family. There are things that matter to them that they really want to be able to maintain for as long as possible. And so how do we do that? By making sure that we communicate those needs to your providers. And I'll also, have this conversation sometimes that, and while movement disorder providers, as Dr. Mohammed had mentioned, they're not always easy to come by depending on where you're geographically located. It is important to find the right provider for you. And sometimes you may find someone who on paper looks fantastic, but interpersonally, it's just not working for whatever reason. And it just may not be a great fit with your personality and theirs. It may be that how they prioritize things is different. Their treatment approach may not fit well for your needs, whatever it may be. So recognizing that, again, you are in the driver's seat on this, and it's important for you to be able to find the right provider that works well with you. So I have some thoughts on how, we've talked about what does self-advocating mean? How does it mean that you get your needs met? How does it mean that, you're able to communicate your concerns effectively? So how do we do that before an appointment? And so one thing I have found in working with physicians and other medical providers is that they tend to think in bullet points. I have written emails now much more succinctly and in bullet point form because that is what they respond to. And so sometimes being able to practice saying your appointment priorities out loud can help you to bullet point your speech a little bit so that way you can say what you need to say in more efficient wording. And there's the old saying, I would have written a shorter letter, but I didn't have time. And when we aren't quite sure how we want to say things, we tend to talk more. So practice things beforehand so that you can say things as directly as possible. Maybe sharing some of your appointment priorities with families or friends because they may have, they may be in agreement with you, or they may have their own perspectives that could be taken into consideration in terms of what they've observed. And always know what your resources are. So again, the Parkinson's Foundation hotline is available to all for questions about anything related to your Parkinson's journey. And sometimes it can help, to be equipped with some of that information before your appointments. And then if there are articles that you've read or new research that you've seen, or there are certain education materials that you really want to review, kind of look them over while you're waiting to speak with your healthcare team, either at home or in the car or in the waiting room. It can be a nice way to pass some of that time because, as we know, those trips can sometimes be a little bit longer than any of us want. So a few things to consider, during the appointment. So again, it's important to make sure that you are able to direct your provider to the things that are most important to you today. So if you do have, your priorities written out, it can be helpful to then just share that with your provider. So, it's nice to see you again today, Dr. Smith. I have a list of some of my thoughts for today's visit. Can I share it with you? And I actually work with med students quite a bit too, and we discuss how to elicit those concerns and thoughts from patients. And we always tell them, if they have a written list, take it from them, actually read it. And then that can also help to make the time more efficient. And, sometimes providers, there are some that are very direct and to the point, and there are some that are a bit more chatty and they may go off topic. And it's great to get to know them a little bit more as a person or have more conversation. But again, we're dealing with a short period of time for which you have your visit. And so making sure that we get to all of those priorities, right? So saying, I know, Dr. Smith, that your time is limited, and I want to make sure that we have time to discuss not just my tremor, but I'm also noticing some increased freezing of gait, and that's really been bothersome, and I want to make sure that we have time to discuss it. And then, of course, if you feel that perhaps your provider is making a recommendation, but there might be some gaps in understanding why they're making that recommendation. So if they are recommending a medication change, or they're recommending physical therapy, saying, okay, I understand that you are recommending this change in treatment, but I want to understand better why or how this is going to address my tremor. So help them to connect the dots a little bit so that they can provide some of that information, because again, sometimes physicians forget what they know. And if at times you may feel that your provider doesn't maybe fully grasp the concern or question that you have, maybe they misheard you, maybe they focus mainly on one piece and not another. And so, perhaps they can give great education about sleep and how that's affected in Parkinson's, but asking, but I do want to know more about what I can do to manage it, and especially if we could do it without maybe more medication. So giving them some direction on the topic that is of concern can then help them really dial into the most important parts for you. And then this sheet is actually available now through the Parkinson's Foundation website, and there is a QR code here in the corner that allows you to, if you use the camera app and you take, to take a picture, and it can take put a link to the actual worksheet that we have here. This is the Parkinson's Foundation's steps to prepare for a Parkinson's appointment. And so it really breaks down all of the things that we've been discussing today in terms of understanding how to best utilize your time during your medical appointment, and really making sure that you are looking at all facets of your life and the ways in which your functioning is affected by Parkinson's. So to show you in a little bit more depth here, and we do have a link in the chat now for downloading the worksheet if that is easier for you. So thinking about how Parkinson's affects your life in every area. So we know physically, yes, there are ways in which it affects you, but oftentimes when I'm working with patients, I ask, but what does that translate to? Someone can have tremor and, but what does that mean? What does that mean for them in their life? Are they someone who does, a lot of toy modeling, and so fine motor skills have been incredibly important to them? Are they someone who really enjoys working with their hands and tools? What are the things that are affecting them in their everyday life, not just from a physical perspective, but how is it affecting how they see themselves and their mental health? How is it affecting relationships? How it may affect any work that they may engage in, all the daily activities of living that they may do on any given day, as well as the fun stuff, the things that make life enjoyable, the things that make us happy, the things that help to increase the quality of life. So really understanding what the Parkinson's symptoms affects in all these different areas, reflecting on what's new in terms of those developments, what matters most to you in your life right now and what you want to address, and what your biggest concerns or worries or questions are in relation to these new pieces to your symptom management. And part two, and sometimes this can be hard and sometimes it's easy, where you choose your top 3 topics for the appointment. So If we can get to more, I might label more, but often, and if anywhere from 10 to 30-minute visit, these are not long appointments where we can sometimes address more than 3 things. So if I can only discuss 3 things with my healthcare team during this visit, what are the top 3? And making sure to list them in that order, and making sure to talk about them in that order. Because sometimes if the most important thing, as Kathy said, is left to last, then you end up with very little time to talk about the thing that matters the most to you. So making sure that those topics go in order of importance. And then remembering that what you do between appointments really does matter. And so how do you follow through on the recommendations that are given to you from your provider? How are you able to make sure that you are advocating through your own education about Parkinson's? How are you accessing resources like coming here today to learn more about how to utilize your medical visits? How do you engage in exercise and support groups and monitor your own progress? And so for some people, they will kind of jot things down as they go if they notice new patterns to their symptoms, or how quickly their medication is wearing off, or if they're noticing new symptoms. They write it down, because so often we may think about something and then it flies out of our mind, and then we don't think about it again until it happens again. So being able to have these things written down sometimes can help to show a pattern that may be developing with new symptoms or progression of symptoms. And I often will tell people that, thinking about the things that you do in between visits to maintain your physical, emotional, and cognitive health is like putting tiny marbles in a very large pickle jar. It may not seem like any one day that you exercise or any one appointment that you go to may make a big difference, but the more you do these things over time, those tiny marbles will accumulate much more quickly into that jar. So we wanted to share with you guys a brief case study on the power of self-advocacy. So going to introduce the story of Maria. So Maria, for me, is an amalgamation of a lot of patients that I see. And so I kind of drew on a few different pieces that I think would be relevant for our topic today. So Maria is a 69-year-old retired teacher who's been diagnosed with Parkinson's for roughly 3 years. She does have medication to help her manage her Parkinson's, and then she does engage in a little bit of physical therapy to help with balance and strength. And it's really important for Maria to be able to stay independent and be able to work in her garden. It's her joy every spring to be able to start doing that again and again, and she wants to be able to maintain that. And right now, Maria is concerned with noticing a bit of increased stiffness, and her sleep is becoming less restful and more interrupted, and she's having trouble both falling asleep and staying asleep for long chunks. So Maria comes in to see her neurologist in October. And she comes in feeling a bit nervous. It's been a while since she's seen her provider, and so she knows that she is going to have to go through the whole physical exam, and she's got to come downtown, and it's a whole process and takes half a day. And she doesn't bring her current medication list because she assumes her doctor has it. And, she forgot that, she's taking an over-the-counter herbal supplement for sleep because, again, she didn't bring a list of the things that she's taking, and it slipped her mind. And she kind of downplayed her sleep problems and some recent falls because she knows that this doctor doesn't have much time, and he seems very busy, and she doesn't want to seem like a difficult patient. And her neurologist decided that they wanted to adjust her medications yet again, and suggested that she return to physical therapy. And she said, okay, that sounds good. I appreciate your help, but doesn't necessarily fully understand why her neurologist is making those changes. And so she leaves the appointment feeling a little confused, a little whirlwind, and isn't quite sure how to proceed with these next steps because she's not sure actually how she's supposed to, is the PT supposed to contact her? Is she supposed to contact them? Or, and why is she going again? And so over the next few weeks, she notices that her symptoms are worsening, her sleep is worsening, and she's feeling rather frustrated and isolated because it's not going to be for another 6 months before she sees her neurologist. So I want to stop here for a moment and invite Kathy back to our conversation here. And I want to, have a little bit of time where we can reflect on, what do you feel like happened here in Maria's appointment? What do you feel like were some of the pitfalls?
So I think that this was a real missed opportunity for Maria, but also for the people taking care of her. And it started very much with the fact that she was anxious. And I think some of the strategies that we've already mentioned can be good ones to address and then mitigate and really eliminate or significantly reduce the anxiety before she even gets to the clinic. The second is that I think there was a missed opportunity to probably deal with to me, the scariest issue, which is the falls. Many of us know that falls are a serious challenge for people with Parkinson's. So I wonder, was she anxious also? Not so much the doctor's busy, but really she's anxious about having to admit that she's had a fall, and she may want to downplay it because she doesn't want to be told, oh, it might be that your Parkinson's is progressing, or it might be that you need to stop doing some of the things like gardening that you love, which is unlikely. She's just maybe going to be told how to do it differently. And then lastly, the issue of medications. I alluded to come in with your list or pre-check it so it's already there, because you can save a ton of time in terms of your visit. And I wondered also if she was a little reluctant to discuss the herbals that she was taking. I mean, maybe she's on melatonin, fine, but depending on the state that you live in, is she using CBD? And does she not want to disclose that to her provider? So chock full of opportunities that are missed and that you would hope can be recovered the next time.
Yeah, absolutely. And I often see that too, where patients may sometimes minimize some of the symptoms that have progressed because they're concerned about what their provider may say, or how they may be asked to limit certain areas of functioning that they feel like could impede on independence. So I certainly see that. And I also see sometimes where people are on supplements that they're like, oh, but it's not a medication. So they kind of think, oh, it's not pertinent, even though it very well could be. And so, there's all kinds of interesting reasons why sometimes people don't disclose some of those additional things that they may be supplementing. And so I appreciate your thoughts on that, Kathy. And I can imagine that there may be some folks in our audience where some of these things definitely resonate.
Very true.
So then let's see what happens to Maria in April. So we call this her take charge visit. So Maria decides that she reflects on some of these, things that didn't go quite well the first time. And so she comes to her appointment feeling more prepared because she now has a list of all of her current medications and supplements, including the sleep herbal remedy. She has a diary of her symptoms and how they have manifested over the past 6 months. And she listed out her priorities, wanting to be able to improve her sleep, reducing some of that stiffness that may contribute to falls, and also being able to maintain that ability to tend to her garden. So she shares that list, symptom diary, and priorities with her provider. And she has a much more open conversation about her symptoms and how they are affecting her daily life, and really emphasizes that her goal is to be able to continue to garden. It's something that she greatly enjoys. We're heading into spring, and she wants to be able to do this as much as possible through the summer months. So she asks for more clarification about her doctor's recommendations, and she asks for written instructions. And I always tell people relying on your own brain for anything is always risky. So write it down, write everything down, have your providers provide written pieces to the visit as well. So Maria then leaves the appointment feeling much more empowered and much more clear about next steps for her care. And so as a result, it makes her feel more in control of her own health, as well as like she has a much better understanding of where she's at with her healthcare team, and that they get what's going on for her and what's important for her. So that way, if she does need to check in sooner than the next 6 months, they already have some context as to what is important to her and why, and what it is that she's struggling with. So based on that, would love to hear, Kathy, some of your reflections on what went differently this time for Maria.
Let me get myself unmuted and back on video. So first of all, I love the graphics, the fall and then the spring. And I think that you now have really side by side two examples: opportunities lost or missed, opportunities fully taken advantage of. And quite honestly, what that will do is that sets the stage for not just the next 6 months, but this is hopefully going to be a long-term relationship with the person who is taking care of you if you are, like me, a person with Parkinson's. So you get more and more comfortable over time. I can absolutely guarantee it, that with raising the tough questions, maybe it's a mood disorder, but maybe you're also thinking about, am I still able to stay in my own home? Or am I able to continue to drive? So this learning early gets you ready for whatever later looks like. And I think that I used to talk about it, it was almost as if we had like a direct brain connection, being able to have that kind of communication. And Taylor, you're absolutely right. If any individual thinks they are the first person who has raised an embarrassing question or one that embarrasses them, no. Everybody in practice for more than, I'd say, a few weeks has heard it all. So you will not be the first, you will not be the last, and you're the one who's holding back, not the clinician.
Yeah, I agree wholeheartedly on that. I so many patients, and they will disclose things that they think are so unique to them, and they feel incredibly embarrassed. And then, once they share it, I'm like, no, actually, you're probably the fifth person who's told me that this week.
Yes.
And so I think just recognizing, yes, this is the time to be open and honest, and it's being honest with your provider, but it's also being honest with yourself. And sometimes that's the harder part.
I think it is, and I would just say to people who are watching this and I alluded to it before, you don't have to consume every last morsel of information that's out there about Parkinson's, even on really wonderful websites, all at once. The advantage is you have time, you're able to absorb at a rate that works for you. So don't feel like you have to know exactly what will happen 10 years from now. No, you don't. You need to be thinking nearer term.
Absolutely. And like you had said, I think, live for today and yourself. I think that resonates so strongly for so many people. So thank you for sharing that.
Thank
And
you.
Well, I hope you all enjoyed hearing from Dr. Muhammad, Dr. Blake, and Dr. Rush as much as I did. Such wonderful, wonderful insights. Dr. Rush is here with us, and here she is on camera. Thank you so much for being here. A
Hello.
reminder to all of you to please continue putting your questions into the Q&A section as we're chatting. Dr. Rush, again, thank you so much for being here. We've got some great questions. To kick us off, we've got a question about when to prepare. So, one person asked us how far in advance of an appointment they should start tracking their symptoms or concerns, and if there's a preferred way to track them. Do you have any thoughts on that?
So I would say start to track after your last appointment. So after you leave your medical professional's office, start to track then. If there are medication changes that they have made for you, start to see, once you start that, how are you doing? What are your symptoms responding to? What side effects are you noticing? In terms of functional translation, are there any things that you're able to do that are a little bit easier, like getting out of a car or being able to garden or handling, fine motor tasks like using your cell phone? Start to track that. I will say there are a million and one different apps out there for tracking, and so I'm sure there are many that you can look into. However, I am also a huge fan of old-fashioned, paper and pencil, and just being able to jot notes down as you go. If that's more your speed, by all means, that is a perfectly acceptable way also. I have some people who also do voice notes, and because handwriting is kind of tough, so they'll do dictation or they'll just do voice notes to themselves on things that they want to remember or things that they're observing. So there are a variety of ways of doing that. There might have been a
I
third part of that, and I can't remember.
no, I think you covered it all.
Okay.
But I love that idea of voice notes. I hadn't heard that one. I think it's really helpful just because handwriting and even the typing can be tricky when your hands aren't working how you want them to. We got a really great question from Shannon about preparing for a visit when the person with Parkinson's has dementia and isn't
Hmm.
really able to speak for themselves. Obviously, in that situation, the care partner is taking on such a huge role in managing things and in navigating the healthcare system. What would you say to Shannon for how to handle that?
Yeah, I work with so many care partners who are the proxy for their loved one during these medical visits because they their loved one can no longer maybe offer succinct or comprehensive reports of their own experiences in a reliable way. And so I still think it's worth, having conversations with your loved one ahead of time in the ways that make sense to get a sense of, what is bothering them, what also you're noticing because you are such, again, an incredible part of this healthcare team. So what are you observing in terms of changes? What do you notice in terms of, how well medications are working or not working? We often will get messages ahead of time also from care partners to through my chart, and it sometimes will give us context for the visit before they come, and they may want to offer information that they don't necessarily want to offer in the visit. And so it's a way for them to ensure that some of that information is then known to the healthcare provider without necessarily upsetting their loved one. So similar process, I would say, as to what we offer for our patients, but a few extra layers of consideration, I would say, because you're trying to speak on behalf of them, and I feel like that's a very challenging place to be, but always done in their best interest, I know.
Yeah, and I think it's such a good point about using the patient portal, my chart, or some of the others. And we actually got another question about that, asking about like the pros and cons, but also I think it just would be helpful for us to talk a little bit about the best ways to use that and the best types of things to share ahead of an appointment using the patient portal, or even after the appointment if you remember something. How, as a on the provider side, how do you hope that your patients are going to use my chart or another patient portal, and what do you recommend folks consider?
So I love when patients send me a heads up my chart, and sometimes I may not actually even see it until the appointment itself. And so it's not always the case that I'm able to prepare ahead of time, but I may see it in real time with the appointment. And even still, it provides a structure for me of what is the most problematic issue that they want to discuss, or what are the things that they really want to highlight that's gone on since I last saw them. And I know my neurology colleagues feel similarly that, when something is given to us in kind of very plain language and, very direct and succinct, it helps us to organize the limited time that we have in the visit, right? And so I think doing those my charts proactively, again, even if your provider doesn't see it ahead of time, it gives them kind of an anchor for the visit. And then afterwards, there may be things that you forget. We're human, it happens. And so, being able to follow up with questions, which every protocol is different in different offices. I know in ours, if the questions are deemed to be a bit more complicated than a one sentence answer, they'll say you need to schedule a follow up with your provider. And so be prepared for that, or know the protocol for what a MyChart message is supposed to be used for, a patient portal message is meant for in that particular clinic. And so, but sometimes patients just have a quick question that they didn't ask in the appointment that can easily be answered, or just an extra piece of information they wanted their provider to know. And sometimes that may mean having to schedule a follow-up visit to further discuss it and give it its time that it's due. And I think having, your neurologist being as part of a team. And so if they have advanced practice providers or others that can see you kind of in between those visits with the neurologist, those providers, the ones that I work with, are worth their weight in gold.
Yes, I totally agree. And when you say advanced practice providers, you mean like nurse practitioners or physician assistants, right?
Correct. Yes.
Yes. Okay, great. Yeah, I think that's good advice. Shifting gears a little bit, we got a question about self-advocacy. Someone shared, I want to be a better self-advocate, but how do I keep myself motivated and positive about my Parkinson's to allow for that? I know, apathy can be such a huge part of Parkinson's for folks, and motivation can be really hard to access. Do you have any insights to share?
I think to be a self-advocate, you're right, it does take energy, it takes time and organization. And so if you're struggling with that, one, I would say perhaps you need a partner in your advocacy. So if you have a loved one, if you have a close friend, if you have somebody who you can partner with on that, who can be an extra set of eyes and ears and an extra mouth to be able to ask questions or be able to help you organize and reflect your thoughts, I would say that would be my number one recommendation. And just realizing that, to be an advocate to yourself just means that you're wanting to be clear. You're not being confrontational, you're not being a difficult patient. You are just trying to help your healthcare team better understand what is happening, how is it affecting your life? And what is it that matters to you most? Because what they see as mattering most may not be what translates to actually mattering in your life. So, how can you be able to advocate even in small ways? So, my tremor is really bothering me. But what really concerns me is that I'm really not confident any longer in being able to hold my grandson. And so, how can you show how those symptoms translate in terms of the ways they affect your life? That I see as a really important form of self-advocacy.
Yeah, I couldn't agree more. I think finding the real life element of it can help provide that motivation, whereas just focusing on the symptom itself may not. So really, really helpful. And then we got a couple of questions about what to do if the relationship with your doctor isn't working. One asked about, what to do if your healthcare team is resistant to this approach of, bringing in what you want to talk about. Another asked, what if I want to ask for a different doctor? What does that even look like? What, in your experience, what can folks do to navigate that piece of the puzzle?
I always say if the shoe doesn't fit, we got to find a different pair, right? And so it's nothing against the shoe and it's nothing against your foot, right? And so this isn't a personal decision. It's their style doesn't match what you need. And that is perfectly okay. And I've had that conversation with patients many times over because they, feel safe talking to me about it because I'm not a neurologist. And I tell people this is obviously a long-term medical condition. You need a provider that you're comfortable with because it's not, you see them once and you never have to see them again. This is an ongoing relationship. So that relationship really needs to be solid. So to ask for another provider, I have very rarely seen it ever taken personally by the physician. I'm not saying it doesn't happen, but it's been a rare situation that I've observed. And usually it's, they may call and say, I just am really looking for another opinion or a different perspective because I just don't know that this particular match is working for me. And you are entitled to a second opinion. You're entitled to more than a second opinion. And so that isn't typically something that offices may balk at. I know we don't. We will easily and non-judgmentally have patients see a different neurologist that may be a better fit for them. So don't, don't come into it anticipating that you are going to offend, hurt, or, scar someone for wanting a different provider. It's just a matter of fit.
So it sounds like, this is something that neurology offices probably deal with fairly regularly. And so calling up your neurology office to say, hey, I'd like to actually shift from, Dr. So and so to another provider, whether you've done a little research to say, I'd rather see this provider, or you could even say, I'm thinking maybe I want to see someone who's more like this. Might be a way to approach it. I think the other thing folks can keep in mind is, if you want to see if there are other experts close by or close enough by that you feel it's worth, the drive, our Parkinson's Foundation helpline is a great place to start. And they can give you a list of who is where and how to get in touch with them. And then obviously, knowing what insurance looks like and navigating that piece will have to play into the puzzle. So yeah, just some different things to keep in mind. Really great question. It doesn't have to feel like a nasty breakup,
Correct.
know that
Yeah.
it's just a reality that sometimes it's not the right fit. Well, great. I think we've got time for maybe one more question. I've got a question about better sort of managing in the moment, including like note taking, making sure you're capturing things that you're then going to take home with you. What do you find folks are doing? Are a lot of folks taking handwritten notes, or a lot of folks taking notes in their phone, or even, audio recording? What feels good from your perspective, and what do you see folks sort of, feeling comfortable doing?
I see all of the above. I have patients who they have their, trusty notebook with them and they're, writing things down as we go. I have some that they'll ask if I'm okay with them recording our time together, and I typically have no issue with that. You have to know what the rules are for your organization and your state in order to make sure that everything is by the book. But do ask before recording, and again, depending on where you live and what their protocols are. I think also sometimes I'll have people have someone who, if they can't have someone join in person, they may have someone join by phone. And so, my daughter lives in Texas and, but she wanted to be here today. So she'll have the phone and the daughter will be involved in the appointment and perhaps she's the note taker in order to ensure that that information is being reviewed and taken down. I have quite a few patients who will asked to ensure that there's a summary written at the end of our visit. So we have an after visit summary section of our notes. And so we'll even usually go over it together, do this, this, and I'll print it out and give it to them. And then that way the onus isn't on them to write those notes. We have been able to do that together. And I have several neurology colleagues who make that a practice in order to ensure that they are absolutely on the same page about medication changes, referrals to physical therapy or speech, or next steps for follow-up. So that way, it's a collaborative process.
I think that's fantastic. This idea of, not only putting the summary notes in for them and printing them out, but even going through them to make sure, okay, and we talked about this and we talked about this. I can see that just for myself as a person who also, is a receiver of healthcare. Really having that benefit of, okay, we've gone through all these things and now I have a printed copy and now I'm ready to go live my life between appointments. Dr. Rush, is there anything else that you think we've missed that that folks should keep in mind as they, head towards their next appointment?
I would just say, as I know is echoed in the presentation, remember that you are the expert on your own experience. Make sure that you come into that visit with the confidence knowing that you know what life is like. You are there to be able to share that, and it is the physician's job to make sure that they take that into account. So come in knowing that, okay, I have my notes, I'm prepared, I have a provider who understands me, and we are going to share a collaboration. So because this is an even footing situation, it needs to be, because you're the one who has to go on and live your life after the appointment. So come in knowing that is something that you have power over.
Wonderful. So helpful. Thank you so much, Dr. Rush, for helping answer these questions from the Parkinson's community today. And special thanks to Dr. Muhammad and Dr. Blake for sharing their expertise as well. As a reminder to you all, today's program was recorded and will be shared in a follow-up email along with a copy of the slides and webinar summary. As you reflect on what we've covered today, we encourage you to think about how you can take charge of your own care journey. Talk with your care partner, family members, or even your support and exercise group about ways to become more engaged. Sometimes it's the smallest step, like writing down a question in advance, that makes a big impact. Remember, self-advocacy is something you can build over time, and you don't have to do it alone. We also want to make sure you have the tools to take action. You can visit parkinson.org/healthcare visits to download the preparation worksheet that Dr. Rush shared with us, along with other helpful resources. These tools are designed to help you organize your thoughts, prioritize your concerns, and walk into each appointment feeling more prepared and empowered. We'd love to keep the conversation going. We've started a thread on pdconversations.org focused on self-advocacy and healthcare visits. It's a space where you can share your experiences and learn from others. If this sounds helpful to you, we would love for you to join us and be a part of the discussion. Thank you again to today's webinar sponsor, MERS Therapeutics, for their support of the Optimizing Care initiative. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. And before we wrap up, we have one last favor to ask. Your feedback is essential to shaping the Foundation's programming. Please take a moment to share your thoughts and let us know what topics you'd like to see in future sessions. Thank you so much for joining us today. Please don't hesitate to reach out. We look forward to connecting with you at future programs. Take care and be well.